Okay. Let me know once you're able to see my screen.
Yes, I can able to see it.
I think this is where we stop disadvantages of POS plan and we need to start on provider payer and NPA, right? Is it?
No, you
This
have.
will be completed.
Yes,
Okay, provider payer. What are the uses of it?
I think EDI.
Okay, EDA. Okay. Yeah, let's start with EDA. So, I'm sure you must have heard of EDA, right? Electronic Data Interchange in terms of healthcare. Have
No,
you?
I don't know
No?
about this.
Oh,
No.
okay. So, EDI or Electronic Data Interchange is a set of standards that is used for structuring information to be electronically exchanged between and within business organization, government entities, and other groups. It's more like a format of standard structure that is followed. Okay, so mm, it's a very secure way of transmitting data between healthcare institutions, insurers, and patients using an established message format and standards. Okay, so that's what it is. Let's try to understand more on this. So you know, uh, when it comes to the various transactions that are there in EDAs, these are a couple of those 834, 837, 835. Have you come across such numbers?
I haven't seen these numbers. So are those like a transaction numbers, like a total transaction numbers?
Yeah, no, these are like the organizations in healthcare industry use around 9 to 10 uh, 10 types of HIPAA electronic data interchange transactions. These are the 9 or 10 transactions that are used in healthcare. So, for example, when you say 837, so this is about claim or encounter. It allows healthcare providers and patients to submit healthcare claim information and encounter information. Okay. So when it comes to like a retail pharmacy claim transaction, it allows healthcare professionals and regulatory agencies to submit retail pharmacy claims. It also lets
Okay,
the
so these are the codes for that claim.
correct,
Okay,
exactly. These are
okay,
the
okay,
codes.
okay.
Yeah. So there's a retail pharmacy claim transaction. It also lets them transfer claims for retail pharmacy services and billing payment information base. If we speak about 835, right? So it's like it is used by insurers. This 835. It is used by insurers to make payments and send EOBs, explanation of benefits. Um, you know, uh, Remittance advice to healthcare providers. So this is the code used. Similarly, 834, where it is used by employers unions, governments agencies, insurance agencies, associations, or healthcare organizations. You know, paying claims. It aims. Its aim is to enroll members in a healthcare benefit plan, right? So that's 834. Similarly, we have 820, where this transaction serves to make premium payments for you know insurance products and is used by healthcare institutions to send information to financial organizations. We have 270, 271. These transactions set is used by healthcare institutions to transmit inquiries for healthcare benefits inquiries for healthcare benefits and subscriber eligibility to financial institutions and government agencies. Same case with 271, very similar. its main purpose is to respond to request inquiries about the healthcare benefits and eligibility associated with the subscriber or dependent. Like in previous transaction, it is used by healthcare institutions to transmit information to financial institutions and government agencies. Okay. Similarly, we have 276, 277, 278, and so on. So yeah, 276, 277. This is used by healthcare providers to request or verify the status of healthcare previously submitted to a payer, such as an insurance company. And 277, no, it is it's used for reporting on the status of the claims previously submitted by providers. So this 277 is used by healthcare payers and insurance companies. So last 278 is used by hospitals to request an authorization from a payer, such as an insurance company or so. So in a few codes that are there, EDI codes that are there. So no, no, no. What does this EDI mean in medical billing? It's a very complex process due to the complexity of billing and coding and the many different parties that need to be involved. So standardization is particularly important here to avoid getting lost in huge number of services, procedures, and diagnostics. Right. So healthcare providers use X12 HIPAA 837 healthcare claim to request payment from health insurance provider, medical billing process, start with an inquiry from the healthcare provider, ends up with payer response. So basically, a couple of steps involved. Maybe I'll come to it. So let me see if it's there. Hmm, okay, let me explain. Okay, so couple of steps that are followed are like the first step is inquiry, and then comes the response. Right. What happens in inquiry is the care providers make an inquiry that including member ID number, date of birth, and payer ID. Like in most cases, it goes through a clearinghouse, an intermediary used to help reformat claims to conform to the HIPAA standards. But it can also reach a payer directly. The role of the clearinghouse is to facilitate inquiries to the payers. The second step is response. When a payer receives an inquiry, they respond to the intermediary, that is a clearinghouse, which in turn sends the data to the care provider system. If there is an error in the data, the care provider corrects it and resubmits it again to the clearinghouse. So, without the use of EDI, all these transactions would be much more difficult to handle because the various systems of providers and insurers would use different data formats. This was initially the case, and the healthcare payment and remittance process tools. The process this was taking a lot of time, weeks together, especially when some errors occurred in the process. Simplifying the medical billing process is not the only positive aspect of implementing ADA. You know, uh, 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 it has many other benefits also, but one of the advantages is simplifying the billing process. Okay, make sense on this?
Yes.
Okay. Next is HIX, Healthcare Insurance Exchanges. So in the United States, health insurance marketplaces, also called as health insurance exchanges, are there are organizations. There are organizations in each state through which people can purchase health insurance. Just like our stock market exchanges, there is health insurance exchanges from where they can purchase health insurance. So service available in every state that helps individuals, families, and small businesses shops for an enrollment in affordable medical insurance. So this is the kind of service that's available in every state. This helps individuals, families, and small business shops for for them to enroll in affordable medical insurance. This is accessible through websites, call centers, and also in-person assistance. Make sense? Any questions?
No questions.
Okay. So moving forward, trying to understand more on it. So as I told, it's a marketplace for consumers to purchase commercial health insurance coverage. The types of plans offered include, ranging from individual policies, small group policies. It supports both individual and small group insurance market. So it's not just individual policies. Small group is also something that is supported here. And health insurance exchanges are online marketplaces for purchasing health insurance, as I told earlier. They're aimed at low to middle income Americans who were previously unable to afford health insurance cover. Although anyone is permitted to use them, the exchanges allow potential customers to compare insurance policies on levels of cover and price. Okay, this is on HIX. Any questions before I go to Hub?
No questions.
Okay. Next is Hub. Hub, uh, these hub services are growing market of offering that allow manufacturers. You have manufacturers to maintain a connection with you know, patients during all phases of prescription. Uh, you know, this allows patients to, to keep a connection during all phases of prescription delivery process. For manufacturers of specialty drugs, the ability to have a single point of contact for the therapies helps ensure efficient medication distribution, right? So it's a service that allows a manufacturer to have a single point of single point of contact with with patients who utilize the therapies, right? So it's meant to provide better and more comprehensive patient patient services actually. Okay, you have distributors, payers, patient, specialty pharmacy, physician network. All these people are connected via hub. Okay. Let's try to understand more. Yeah, as I was saying, it's a service which allows the manufacturer to have a single point of contact with patients who utilize the therapies. So a hub is meant to provide better and more comprehensive patient services. Okay. So vendors of hub services offer a variety of options for the clients, including benefits investigation and verification, prior authorizations, you know, drug delivery and administration, co-pay support, financial assistance, and payment education, patient education. So these are the few you know where options that are provided for the clients. So a lot of things ranging from drug delivery to the education, hub helps. Okay. Any questions?
So this is like a software, or is it like a online portal kind of?
Uh, no, it's not an online portal kind. So, let me see if I can get that link. Okay, let me see if I can get that link. Just give me a minute. I'm trying to get that. And seeing if I can get that link. There is
Or is it like that service where if the patient, or like how all different doctors office and pharmacies, they can able to see the patient which prescription or medication they are taking.
sorry, come again. One place where you can, everyone can see all the
Can
information about the
see
patient
all
is
the
what you are trying to
information
say.
about the patient, like what prescription is that patient is taking.
No, no, no. That's not a hub. That's not a hub. So hub is more on the, know, business side of it. The business side of it. If you see here, it's mostly for manufacturers to maintain a connection with patients during all phases of prescription delivery process. So this hub is more like a single point of contact for the therapists, help ensure efficient medication distribution. So no, I don't think that's the case, but I'm trying to see if there is any portal.
Okay, I think so. It's like starting from they launch the prescription until to the distribution.
Hmm. Yes, yes, yes. Yeah,
Okay,
from
okay,
from
okay.
from the prescription to description delivery of the medicine.
Delivery of the
The
prescription.
medicine.
Okay, okay.
Yeah, yeah.
Yeah. Okay, okay, okay. I got it now. So it's more of like towards the launching of a
Yeah.
medication.
I was not able to see any portal as such, but yeah, that's what it is. Next is let's try to understand more on the state-run HIX versus federal HIX. Now, what is state-run HIX or federal HIX, right? State-based marketplace, also called as SBM. So those states running a state-based marketplace are responsible for performing all marketplace functions for the individual market. So consumers in these states apply for and enroll in coverage through marketplace websites established and maintained by the states, right? So coverage through marketplace websites established and maintained by the states. Basically, this is the state level, right? And next is the federal level. So so one second. Yeah. So for the federal platform itself, the these states are considered to have a state-based marketplace and are responsible for performing all marketplace functions for the individual market, except that the state will rely on the federal healthcare government website for eligibility and enrollment functions. So here in this case, it's purely the consumers in this states apply for enrolling coverage through marketplace websites established and maintained by the state. But here, the individual marketplace except the state will rely on federalhealthcare.gov website for eligibility and enrollment functions. Okay, there's a difference between state-based marketplace and state-based marketplace federal platform. Okay. So next is on ICD, International Classification of Diseases. So ICD is the global health information standard for mortality and morbidity statistics, right? So mortality and morbidity statistics. So ICD is increasingly used in clinical care and research, wherein it is used to define the diseases, study disease patterns, as well as manage healthcare, monitor outcomes, and then based on the based on this outcomes, you allocate resources. So more than 100 countries use the system to report mortality data, a primary indicator of health status, right? So this system helps to monitor death and disease rates worldwide and measure progress towards the Millennium Development Goals. Now, by the way, one basic question: what do you think is mortality? Heard of it? Mortality.
Mortality?
Yeah.
Uh, to use mortality. Yeah, I heard the name, but I don't know the exact definition of it.
Okay. Mortality means death only. Okay, right. Yeah.
Death, death.
Yeah.
Okay.
So mortality means death, and morbidity means more like no, it's more of a suffering from a disease or medical condition. This is
Yeah,
death, and this is more of a medical condition.
yeah.
So the system helps to monitor death and disease rates worldwide and measure progress towards the Millennium Development Goals. Right? Okay. So is a foundation for identification of health trends, statistics globally, and it's the international standard for reporting diseases and health conditions. So this ICD defines the universe of diseases, disorders, injuries, and other related health conditions, and listed in a comprehensive way. So it organizes information into standard groupings of diseases, which allows for easy storage, retrieval, and analysis of health information for evidence-based decision making. Right? Sharing and comparing health insurance between hospitals, region settings, and countries. Data comparisons in the same location across different time periods. So it gives a lot of such data wherein this data can be looked into and they take decisions. So yeah, any questions so far?
No questions.
So this ICD purpose and uses is the diagnostic classification standard for all clinical and research purposes. These include monitoring of the incidence, prevalence of diseases, observing reimbursements and resource allocation trends, and keeping track of safety and quality guidelines. So ICD allows the counting of deaths as well as diseases, injuries, symptoms, reasons for encounter, factors that influence health status, and many external causes of diseases. Now, when it comes to primary users, right? So users include physicians, nurses, health workers, researchers, health information managers, policymakers, insurers, and national health program managers, like all these things. So this is on the ICD purpose and users. So any questions?
No.
Okay. So I think this completes our course. Okay. So with this, we have completed the BA and the healthcare also. I know it took a lot of time, maybe 1.5 months, right? 1.5 months or 2 months. So
Yeah.
it was a long duration, but ultimately, yeah, we have completed. But if you have any questions, queries, I'll take it up now.
Okay.
Or otherwise,
So
also,
I
you have
will.
my number. You have my number. We
Yes,
can
yes,
always
I have your
keep it.
number.
Yeah, we can keep in touch if you have any queries. You can
Okay.
ping me anytime. Yeah. So
Okay.
yeah, go ahead. Sorry, you were adding something.
Yeah. So no. So the drive that you shared with me.
Hmm.
You know how there's like the business analysis interview questions.
Hmm.
In
Hmm.
that there's like some 101 questions. In the other part there's like uh I think 125 or 140 some questions.
Hmm.
So is it, so do I go through both of them, or is it only one of them?
I'll go through the bigger list one first.
Bigger list one
Okay.
first.
Yeah, yeah,
Okay,
yeah.
yeah,
And
because in the other one, the 101 questions, there are a lot of questions where I do not have any idea about, because in I think one of the question um that I saw is like what is OLAP, and I think that's what it said.
mm, no,
Uh
don't worry about all that. That is, more of a business analytics
yeah,
one. Yeah,
yeah.
don't worry about that.
Yeah, and
Yeah.
also it said something about uh let me find the question. Something about the software section. It said
Mm-hmm.
something about the pools and swim lanes, and then
Okay.
yeah, and then it said something about like how can you substitute or which technique you use when you're performing multiple interviews. It
Mm.
said something like all those questions.
Yeah, those are like in detailed ones. So
Uh-huh.
more for theoretical ones. Don't worry about OLAP and all.
Uh-huh.
Those things will not be asked. But if you can stick to questions related to whatever we have covered in
Yeah.
the course, that should be
Uh-huh.
more than enough. No, yeah,
Okay.
that should be more than enough.
Okay.
Yeah. Okay. Go through the bigger list one, and
Okay.
yeah, then we'll take it from there.
Okay. Sure.
But yeah, but definitely, anytime if you have any queries or anything, just reach out to me. I can
Okay.
help you. Okay.
Okay.
Yeah.
So, what will be the next step?
Next step, the team will connect with you. They'll help you
Okay.
in terms of resume,
Uh,
interviews, and other things.
okay.
Okay. So
So will
whom are you in touch with in terms of the team?
I think before while I was talking about the class I had with Vikram, I spoke to him,
Okay.
and then I think Satya, he's a trainer. He called me sometimes. Yeah, that's all, only two people I usually talk.
Okay. 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 Sure. I just notified that you're done with the course.
Okay.
I'm telling them, help her with next steps.
Okay.
Okay.
And
Okay.
is there like any exam or anything, or is it
No,
just
no, I think there will be few mock interviews, kind. That's all.
uh-huh.
But no
Okay.
exam as such. No exam.
Okay. 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 Okay.
Okay. Then. They will get.
Okay.
No, I just messaged them also.
Okay.
They will get in touch with you. Okay.
Okay, sure.
Yeah, okay. Okay.
And
Okay.
you're going to send this one on the drive.
I think this is already there in the drive. If not, I
This
will
is
check and
already in the drive. Okay.
yeah. If not, I will check and place it. Okay.
Okay. Okay.
Mm. Okay, Priyanka.
All right. Thank you.
Yeah, thank you. You take care and yeah, keep in touch. Okay.
Okay. All right. Bye.
Sure. Thank you. Bye.